Good. Welcome to True Health Tuesday, and the truth will set you free. Cervical, spine, and shoulder. Okay, now what's interesting about this is a lot of people don't understand and what importance this is. Because we talk to almost every patient about it. But if you look at the cervical spine, it's not only called the arc of life for a reason, but it's not appreciated even in chiropractors. Okay, chiropractors are starting to lose the knowledge of the nervous system. So now, what kind of things result from a problem with the neck? Okay, we're talking most headaches, carpal tunnel syndrome. Yes, carpal tunnel syndrome. The numbness and tingling in the wrist is a double crush injury beginning in the neck, leading to a problem with the wrist. Shoulder, rotator cuff problems, that begins in the neck, leading to a muscle imbalance. And you're gonna see, we're also talking blood pressure issues. Okay, we're gonna talk about arthritis. Is arthritis a problem or an adaptation that's intelligent? So let's look at this. First, headaches. Statistically, 93% of them come from the neck, cervicogenic, okay? And 93% of the time, so when somebody comes up and they say, oh man, I got these headaches. Well, you have a 93% chance that I can fix it. That's a pretty good chance, okay, because it's coming from the neck. About 7% are coming from alcohol, drugs, toxicities. Don't worry, I'll show you how you can drink without getting a headache. 1/10. He just started on staff, Lord knows, okay, it's his third week, he's probably gonna wanna learn how to drink. Okay, so when we look at this, let's just look at what normal is, because what drives me crazy is that in psychotic society like today, symptoms are covered up with medications. So, and that doesn't make any sense, not if you think that the body's intelligent or have any basic knowledge. We're looking at a normal side view of an x-ray of a neck. We're looking at an abnormal on the left. And so when you see loss of curve, forward head carriage, all of these different pathologies, and I actually had a patient, this is when I first started in practice. There was a medical office that opened up, and they actually closed a few years ago, so they were only open about 10, 15 years. And they sent me a patient who is about 32 years old with carpal tunnel. And I said, cool, we could develop a working relationship, they can send me people that they, want to get really helped, and I can send anyone that I feel that needs to be drugged to death. I didn't tell him that because I just started in practice, okay, and I wanted to have a working relationship, okay? And so I go in there, and I had a similar set of x-rays. In fact, I made a poster out of this. I don't have a picture of the poster, but it showed a reverse curve, and then 6 weeks later, we showed a normal curve. So I took these two x-rays over to the doctor that referred, and I said, check this out. I said, here's before and after. This is the gal that you sent me. They said, wait, who do we, what was, and I said, well, it was Marie, the 34-year-old gal. And, they're still looking at me blank-looked. And I said, carpal tunnel syndrome. Oh, the carpal tunnel case. I said, yeah. And I said, do you see the difference? They said, no, not really. No, seriously, it's not a slam on their intellect or their observation, because you're looking at this and you're seeing two totally different shapes. But you understand the medical system now is not taught that an abnormal structure will lead to an abnormal function or pathology. So what they're doing is they're looking at the x-ray on the left. There is no tumors, fractures, or other pathologies other than misalignments. Since you're not taught to correct structural misalignments, they're not seeing that as a problem. Okay, that was like my, wow, holy moly, we got to fix this. So let's look at this. Is the body smart or stupid? Smart. I think it's smart too. So we're looking at a normal posture on the right. We're looking at an abnormal posture on the left. Now for every 1 inch the head's forward, the pressure on the discs double. So if you have one or two, I know no one looks like this person on the left, but you do work with her, right? Okay, you see the person in the next cubicle. Well, the body is smart. Now, we don't have conscious control of the muscles that run down either side of the spine. There's two types of muscles. Postural muscles, which you don't have conscious control over. They're governed under the control of proprioception, or your body's position in space. Phasic muscles, arm and leg muscles, you can work with these. And I've had several doctors come in that I guess they were asleep in biomechanics, but they said, oh no, I can spasm this out. See, when I throw my head forward, it spasms out. No, that's changing proprioception of your brain's position. So if you put the head forward, for every 1 inch that head goes forward, the pressure on the disc double. So if you have, say, 2 or 3 inches forward head carriage, those muscles are going to instantly fire off to pull this head back into alignment in order to change the force loading on that. Okay, so the body's intelligent. Now here's the problem. How many people go in there and say, oh man, my shoulders are chronically tight. They're always tight. They're always firing off. And I'll say, well, why don't you fix the problem? And this shows what a nasty instructor I was. You know, when we're teaching human dissection, we'd have a cadaver over there, and I'd say, you know, baiting the students, who here would relax a tight shoulder muscle in order to have the body accept the adjustment? Okay, I know, you know the answer, okay? And they're all going, oh yeah, I would, okay? And I'd say, really? And so I'd pick a student that had forward head carriage like this, and I'd explain for every 1 inch the head's forward, the pressure on the disc double. So if you go in and you massage this person, okay, any one of those 3 people on the bottom, those muscles are trying to correct it, and you relax those muscles, which way is the head going to fall? Further forward. Okay, so you're going to increase nerve damage. No, you do not relax the muscle. You find out why the muscle's in spasm or increased in tone. Does that make sense? Absolutely. So the curve in the neck is literally called the arc of life. We're looking at a normal one on the left, and the other ones are pathology. Now, movement triggers dopamine. Parkinson's is known to have an alteration in dopamine. So do you see anyone with Parkinson's walking around like this? No, that guy should be wearing a zoot suit, okay? Okay. Anybody remember zoot suits? I mean, thank God there's 3 of us here. Okay, so okay, that's like twirling like a pocket watch chain. No, what happens is forward head carriage, and they start doing this because movement triggers dopamine. If that head's forward, the brainstem is being pulled, altering brain function. So if we're looking at a loss of curve in the neck or forward head carriage, the pathology starts to result. Now we're looking at before and after on Parkinson's, you know, massive forward head carriage. We're showing it slowly coming back. But wouldn't it be cool to have somebody with an altered nervous system or an adaptive physiologic response like Parkinson's and have their x-ray checked first? Now, shoulder, rotator cuff problems, carpal tunnel syndrome, how do we know it comes from the neck? Well, we've got this nervous system that comes out of the base of the neck, and it's called the brachial plexus, and it supplies the entire arm. Now, what's cool is one of the most brilliant doctors ever, okay, he told me that there's 2 things you got to do to find out what's wrong with the patient. 1, you got to ask them, and 2, you got to listen. It's harder than it sounds, Doc. Okay. But, you know, people will go in there and they'll go, Doc, man, it's killing me. It's right here. It goes right up here. And I was, that's a 6th cervical nerve. I know I can fix that. It goes right down here, right up here. That's the 8th cervical nerve. Why? Because there's a thing called a dermatomal pattern where a compromised nerve root up here will come out, and it actually presents that. And you could decide on if the lesion or the problem with the nerve is proximal or right next to the spine or peripheral when it comes down further. It's really cool. And we were actually at this one x-ray class, and they were talking about how they were going to have testing, because it now requires, I think, like 20 hours of post-education to keep our licenses current. And they said, how many people would like post-testing? I mean, how many people here would like to draw out the brachial plexus again? How many could? Well, I raised my hand. I said, I could do it. Okay, because we learn mnemonics, okay, roots, trunks, division, chords, branches, and the mnemonic is 5, 3, 6, 3 many, so we know there's 5, you know, and we go through, and that's how you memorize this stuff, by mnemonics. Did you have to draw out the brachial plexus? Yeah? Okay, good. I'll show you how the mnemonics, so I'll show you how to do it really easy. But this is important because depending on where the lesion is or where the problem is, it's literally going to present. But this is also one of the factors, because when we talk about carpal tunnel syndrome being a double crush injury, that means it begins here and leads to a problem in the wrist. Shoulder and rotator cuff problems begin here, lead to a dysfunction. What kind of things are we looking at? Well, for one, we have this rib cage area. Now imagine we've got this rib cage that's almost like a cone, an upside down cone. And the ribs are super protective. You got the heart and the lungs in here. And in fact, you could take a huge impact and the heart and lungs still work. The heart has blood vessels that come out that supply the arm. And then you got nerves coming out of the top. Now, remember we were talking about forward head carriage? If you have forward head carriage, you're compromising both the blood supply and nerve supply. Now, we've got these muscles called rotator cuff. Now, we've got this bone here called the humerus, and it sucks this humerus into this little cuff called the labrum. And it's not like the full socket like the hip, but it sucks it in there, and you get full range of motion. Well, if that heads forward, you actually compromise the blood supply and nerve supply to the topmost muscle. This is why supraspinatus, or the top part of the rotator cuff, is the most commonly damaged. I know I'm talking about a lot of anatomy and physiology terms, but it's going to make sense. But think of this. This person with the forward head carriage, do they have healthy blood supply and nerve supply, or is it compromised? You cannot imagine how many thousands of patients over more than 20 years, they come in and they say, yeah, I've got a workman's compensation thing. It's for shoulder and bursitis and stuff. And, you know, the ultrasound and ice isn't working. You know, I still have this problem. Honestly, has anyone looked at the neck? What do you mean, doc? You know, it's in the arm. Honestly. I mean, after 5 minutes of anatomy and physiology, do you think that checking forward head carriage involved in shoulder and rotator cuff problems and elbow injuries, golfer's elbow, tennis elbow, all of these things, do you think that that might be a factor? Duh. Okay, so let's look at how to rehab the shoulder. First, when a normal human is standing, you should see the thumbs. This is normal. You know what you're going to see with people with shoulder injuries? Okay. They're going to be walking around like this, and you could even see this in the mall. So we're talking massive internal rotation, forward head carriage, total destabilization. If you don't believe me, check it out. When you're walking in Target or Walmart, you're going to see people walking around like this, and they'll be saying, oh yeah, I've got shoulder issues. So now first, what happens on this? Remember, you got this humerus stuff shoved inside of this little labrum, and the labrum is really cool. It holds it so you've got strength and great mobility. Now, if you've got forward head carriage, the supraspinatus, the topmost muscle, is going to be weakened. Now, you got these muscles that are holding this arm inside of this little labrum. Now, the topmost muscle, the supraspinatus, is the one that's most easily vulnerable, the most damaged one. Now, if that thing is weakened, the shoulder doesn't fall out of the socket. It falls up. This is the weird part, because you got this massive muscle on top called the deltoid that's always exerting a superior force. So everybody with a shoulder injury, yeah, man, they can carry a huge weight down here, no big deal. You go like this, ow. Okay, it's called impingement syndrome. So, and what people will typically do is understanding that there's going to be forward head carriage, some type of damage in the neck, leading to problems with the shoulder or rotator cuff. Okay, and then you get this up jamming. Think of what that labrum does. It has a dislocation or a distortion in that labrum, so it sloshes around. And we can identify it really easy on you know, a patient who's laying down there. We drop it down in place, push, and we hear this, okay, yeah, you got an unstable labrum. Now, in psychotic world, think of this. Okay, so we're talking rotator cuff problems or shoulder problems. it's unstable. You've got this humerus sloshing around in a cuff or the socket that's not correctly shaped. Okay, does that make sense? Now, in psychotic world, they're going to try and give you full range of motion if you have a shoulder injury. Well, is the socket fully formed? Is there a problem with the socket? There's a problem with the socket, and this is why they're looking at slap lesions, which is a superior problem with the labrum. They're looking at all of these different things. They're even teaching in certain schools. Remember, you've got a bone inside of a socket that's distorted. That socket, that labrum, is supposed to maintain integrity of that humerus. So you know what they'll do? They'll say continuous passive motion with a weight. Well, that doesn't make any sense because the labrum's not, it's completely ridiculous. So this is how you fix shoulder injuries. You do not go for full range of motion. That's psychotic because the thing isn't stable in there. Okay? It just doesn't make any sense. So what you do, you need to have a weight. Now, these things are about 20 pounds. You would need it if you have little spindly arms like Dr. Ryan, or, okay, yeah. Okay, granted, his arms are the size of most human legs, okay? Okay, or you need it if you have, girl arms like mine. Okay, so what you do is you take this weight, straighten the arm, turn your palms forward. So what does that do? That turns that humerus inside and reforms that labrum. Because remember, you're dropping it down. And this is the easiest exercise in the world, where you just turn your palms forward, leave your elbows straight, and you're just going to swing it butt to belly, butt to belly. And what that does is it's dropping it down in place. You're reforming that labrum. Do this about 10 minutes a day, and you're literally reforming the labrum. I mean, it's beautiful. It may take a couple of weeks to do it, maybe a little bit more, but do you need to fix the neck component as well? Yes or yes? So many people are going to, yeah, I tried that, doc, it didn't work. No kidding, you're doing it with a tourniquet on your arm. Some people may need, 5 pounds if they have little arms, 10 pounds if it's bigger. But you have to have enough weight to drop that shoulder in place. Now, there's a lot of ways to do this incorrectly. Okay, a lot of ways to do this incorrectly. If you have the weight, am I moving my shoulder? No, not at all. Am I moving my shoulder? No, not at all. I know, we see this all the time, Yeah, so you have to have a weight that's sufficient to drop it down and reform it. It may take a couple of weeks to do it, but you've got to fix the original problem. If you're not fixing the neck, you're not going to fix the way that the supportive structures. Bursitis. Okay, how'd you like to know what the cause and how to fix it right away? Would this be of value to anyone? Okay, itis means inflammation. Bursa sacs are full of bursa fluid. Bursa sacs cushion the tendon. Now you got a muscle. The muscle attaches to a bone via a tendon, and tendons cross joints. Well, now if you move that tendon a whole bunch, it's crossing a joint, right? Okay, so we need that bursa sac that's full of bursa fluid to cushion that, so it has an ease, so we can work for forever. So piano players can play very, very fast and their hands don't catch on fire. From fiction, okay? So when you talk about repetitive motion injuries, there's not a repetitive motion injury. Okay, can you just imagine the number of comments that are going to say, oh, yes, there is. I was a checker and I did this and I did the same activity. Okay, great. Let's have 2 checkers. One does the exact same job as the other. Are they both going to get repetitive motion injuries? No. So it's not the repetitive motion. One's doing their job like this, the other's doing their job like this. Okay, one's had an old trauma, and that's what you're going to see. You do it with compromised blood supply or nerve supply, yes, you're going to develop pathology. You do it with normal blood supply and nerve supply, you're not going to develop pathology. Does that make sense? So when you're looking at this, in psychotic crazy world, bursitis means that there's inflammation. That means that that tendon is rubbing against the bursa sac. That means there's no blood supply or fluid to it. So in Crazy World, they would put ice on it. We're not going to put ice on it, because you put ice on it, does that increase blood flow or decrease blood flow? You're slowing everything down. Put a steak in a freezer. See how flexible it gets. Okay, so, okay, I'm telling you the truth. I just saw a video of frozen people. Okay, they don't move well. Okay, so if you put heat on this, okay, and take it away, what color is that? Red. Why? This is the brilliance of the body. If you put heat on something, the brain senses that temperature differential, so it's going to actually increase the blood flow in that area to equalize the temperature. So you're tricking the body. You're tricking the body to increase the blood flow because the brain wants to equalize the temperature. You increase the blood flow, you increase the synovial fluid production, you increase the bursa fluid production, you increase the production of all of those in the cushion, all the stuff that you need to take the pressure off. Okay, do you want to say, wow? And what do they teach you in school, Doc, for bursitis? Ice, I know. That's okay. If they ever let me on campus, I'll explain it to them. Okay, but can you see that? But again, this is only a parlor trick. This is only something that's going to temporarily help, because if you're not fixing the problem, you're not going to help the person. Also, you're going to see electrodynamic bursitis where I mean, it's big. I mean, this is painful, sticking out. We just had a guy who'd had it for 4 years, and guess what kind of therapies? Ice, told you not to, don't use it, don't move it. Yeah, right. Try life without moving your elbow. Okay, so what we did is suggested pressure and heat. So we gave him a little tiny elbow support that put pressure on there. It's made of neoprene, so it's going to generate heat. And what do you think we fixed? The neck. Oh yeah, that's right. So that was the main thing that led to the altered pressure, okay, of the nerve or of the structures that supplied it. Now let's look at carpal tunnel syndrome. Let's look at the forearm. You have muscles on this side called flexors. You have muscles on this side called extensors. Okay, flexors and extensors. Now, strength ratio in a normal human being is supposed to be 5-4. That means the flexors versus extensors are almost about the same strength ratio. Now, the nerves in the neck supply the arm. Remember the brachial plexus, Robert Taylor drinks cold beer, root trunk branches, okay? So we look at that. If you have compromised blood supply or nerve supply, you're going to weaken the structures involved. But also look at the biomechanics that people are going through. How often are we doing the extensors? We're not making fishing nets anymore. So let's say somebody types all the time, or grabs the steering wheel all the time, or grabs, because you're always flexing. So what we're going to do is create a muscle imbalance, okay? So if the flexors are not a 5-4 ratio in relationship to the extensors, this thing gets super, super strong. Guess what happens? I'm doing a physical exam on people and they're saying, yeah, I got numbness and tingling in the hand. I'll look at it and I'll see, instead of a normal forearm sticking out, I'll see it atrophying or shrunken in. And that could either be a neck, more than likely contributing to it, or biomechanics throughout the day. So how do you correct carpal tunnel syndrome? Well, for one, you got to fix the neck, restore the nerve supply. Now, you may see braces, okay, braces for carpal tunnel. Doc, do you know where the electric tape is? Can you be my assistant? Good, grab one, okay, because I'm going to put a brace on you. Okay, so now I'm going to show you, because do you know how you make a muscle imbalance worse? Say brace it. Okay, good. I know. Sorry, the swelling here is really bad. Okay. Okay, this is what you're going to do. Has a new brace. This is a roll of carpal tunnel braces. No, it's not. It's electric tape. Okay, why do we use electric tape? Because it doesn't stick to fur. Okay, it's really nice and it's flexible. Okay, so what you do, this is how you do it, okay? Put your thumb and pinky together. Now what we're looking at, keep those things together. I'm going to turn your hand. Let me turn it. Jesus. Ugh. Okay, these things here are called metacarpals. What you're going to do is go right around the base right here, just with a piece of electric tape. Now you're not going to do it too tight. Okay, now move it around and stuff. And look at this. Oh my gosh, it maintains the integrity of the tunnel, so you're not going to have compression of that median nerve. And so while you're fixing the neck and you're fixing the muscle imbalance, beautiful. This one here takes the pressure off. Cool? Cool. Thanks, Doc.
Welcome.
Yep. Poor boy's never seen the inside of a gym. Okay, so also, we have this wrist extension device. It's not a rubber band. Don't say it's a rubber band. Okay, it's a number 32 rubber band. So what you do is, remember, these muscles go underneath a band of tissue. Now, it's really cool. It's called a flexor and extensor retinaculum. Like if you take the skin off of a cadaver, it actually looks like a tennis brace. Now, in psychotic crazy world, the surgery that they do to correct carpal tunnel syndrome is actually to cut that band of supportive tissue called a flexor retinaculum. And you might think, well, that's kind of weird. Doesn't that destabilize the wrist? Yeah, but it decreases some of the symptoms. However, if you're curious, 80% of the time, carpal tunnel surgery has to be repeated in the other hand. Why? Because they're missing the source. Most of the orthopedic texts aren't looking or listing it as a double crush injury. Only the old chiropractic texts are listing it as that. And so what you do, once you get, the muscle imbalance corrected or the nerve supply to this area corrected, you take a number 32 rubber band, put your hand like a flower bud, then make it into a claw. Flower bud to claw. So try and scare a little kid. And the reason you want to extend it out, okay, and because you're working just the extensors. You don't want to wave because this is not working the correct muscles. You want to actually extend it out, okay? And this will work the muscles on the outside and restore a muscle balance, okay? And here you go. Here's a free carpal tunnel exerciser. No, I'm going to give it to the guys that were paper boys. We already had a discussion.
Do I get to do it back?
No, you don't shoot it back. I've got a whole box here. I could put out an eye with those. Okay, so now let's look at also hyper-kyphosis. So now think of this. We've got a normal. Now, there can be some pathologies that will develop an increased rounding over the shoulders. Okay, this could be from fractures. Fractures don't happen in normal humans, only in human beings who are very acidic. Okay, so we're just talking about rounding over the shoulders has an adaptive physiology. Now, it's not hereditary, it's an adaptive physiology. So think of what happens. If this head is thrown forward from some type of trauma, all of these muscles that support the head stop in between the shoulder blades. And so if they're in chronic spasm, these discs and these joints don't get the appropriate nutrients. See, discs are unique. They have a really horrible blood supply. Okay, because they usually get their nutrients through movement. And if you decrease the movement, then that disc gets smaller and smaller and smaller. Well, these nerves that come out of here, particularly at the top of the thoracic area, the top of the rib cage area, those nerves are the sympathetic nerve supply to the heart. Now, most human beings only have one heart, okay? Klingons have two, you're right, okay, I don't want to mess with the Trekkies. Okay, but I mean, if you're a human, you got to really be careful of the nerves that supply that heart, right? So what happens is, if you've had long-term forward head carriage, you're decreasing the motion of the thoracic area. The body is going to adapt by increasing the thoracic curve. Why? Because if you bend this forward, now the people in the front row can see that these holes where the nerves come out open up. Isn't that interesting? So that rounding over the shoulders is actually an adaptive physiologic response. That means that it's rounding over to save the body, to save the pressure on the nervous system. So you can actually correct that hyperkyphosis by restoring the normal curve in the neck, repositioning the bowling ball of a head, which is about 15 to 18 pounds, and then that you can induce normal motion of the thoracic area, and then that can regenerate the discs, decreasing the hyperkyphosis. Now here's a weird one. What if people have this type of body posture? Do me a favor, just sit up nice and straight, just for a second, okay? Take a deep breath. Okay? Now, round over your shoulders as far as you can, and now take a deep breath. Oh, it ain't happening, is it? Okay, so now this is weird. We're looking at the person way over there on the right with this extreme hyper-kyphosis, knowing that they can't expand their lung capacity, that it's harder to breathe, knowing that you need oxygen in order to have healthy, heart function. Do you think that perhaps that person on the right is going to have to develop high blood pressure to adapt to that pathologic situation? Yes or yes? Yeah, so in crazy world, we're not going to just give everyone the same blood pressure medications. We're going to find out why their body's adapting. So now let's look at the heart. Because we're talking about the cervical spine, we got to talk about the heart. The heart has two nerve supplies. It's got parasympathetic and sympathetic. Parasympathetic is actually coming out of the top of the cervical spine or the base of the brain. That's the parasympathetic. That's cranial nerve 9 and 10. The sympathetic nerve supply to the heart is the top of the thoracic area, T1 through T4. So think of this. Let's say someone has a whiplash trauma. Bam, head's been thrown forward. All these muscles fire off. So we can actually alter the parasympathetic and sympathetic nerve supply. Both of those nerves supply the heart. We know that. Now we have a natural rhythm to the heart, okay? And that is the parasympathetic, that's the pacemaker of the heart. So if you have a problem with the upper neck area, or better yet, let's look at it different. If you have a problem with cardiac arrhythmias, and we did an entire hour on cardiac arrhythmias, okay, if you're not paying attention to the nerves that supply the heart, you're really missing the big picture. In fact, one of our patients is a medical doctor, and he says, yeah, we're taught about this. We're taught about the autonomic nervous system. We're taught about the location of the autonomic nervous system. We're taught that it supplies the heart. Then we're talking about the drugs and the pacemakers we can put in. Okay, let's look for the source of it. Okay, does that make more sense? Here's a perfect example, a before and after x-ray. Now, this fellow is pretty much standard for the patient that comes in. We're talking high blood pressure, indigestion, low functioning thyroid. It's not a low functioning thyroid, he's got systemic inflammation. Inflammation is going to trigger the adrenals, and the adrenals are going to make the thyroid, if they're firing off, they're going to suppress the thyroid. If we're looking at an alteration in the thoracic area, do you think maybe his heart may have to increase its pressure to get more blood flow because he's going to alter the surface area of the lungs? It's like, duh. Okay, so how about we take a second guess at the body? I know this is a big shocker because it's 2017, is intelligent and actually will adapt to a toxic deficient environment to stay alive. Sure enough, within about 2 weeks, his blood pressure started to normalize. Indigestion was corrected. We fixed his sleep patterns, and we're actually remodeling his spine by causing inflammation. That's right, we cause inflammation at the level of the discs to regenerate them, altering the physiology, because we don't look at high blood pressure, indigestion, or low thyroid has a problem. They're not pathologies that need to be treated with medications. Those are adaptive physiologic responses that are intelligent by the body. And you correct the reason that those situations are there, you fix the problem. So let's look at the data. Journal of Manipulative and Physiologic Therapeutics, 1988. Oh my gosh, it turns out that adjusting the spine caused blood pressure to normalize. Why? Why? Because we got this person that's in a fight or flight or stress state, you adjust it, you alter the nerves that supply the heart, and it functions more correctly. Again, Journal of Human Hypertension, 2007. Atlas vertebrae realignment achieved arterial pressure goal in hypertensive patients, a pilot study. And I love this. No adverse effects were recorded. Yeah, you know why? We're making the body function normally. What's the side effect of normal? Health. You're right. It's okay. Don't worry. The person will achieve health. Okay? We conclude that restoration of the atlas misalignment, this is the very top bone in the neck, is associated with marked and sustained reductions in blood pressure similar to the use of 2-drug combination therapy. I got a little challenge with that one because you have high blood pressure. Is that a pathology or is that adaptive physiology? Now think of this. If you have high blood pressure, is your body adapting to a pathologic, a stress state, or is it really a disease? Why would this work? Why would taking pressure off the central nervous system normalize blood pressure? How about we look at it a little bit different? Or we could look at the University of Alabama. Blood pressure medications can lead to increased risk of stroke. Okay, who wants to do the Homer Simpson? Don't! Okay, so scientists found that the risk of stroke went up by 1/3 for each blood pressure medication taken. Stroke. People who needed 3 or more medications were about 248% higher risk than those of normal systolic blood pressure when it was less than 120. Amazing. You're in as much trouble by the time you're on 3 medications that achieve excellent control as you are when hypertension is untreated, which is amazing. We want to raise the issue that despite great advances in pharmaceutical approach, relying solely on this approach is going to come at a dear price of people's lives. Yes, it is true. I'm glad you're all sitting down. The doctor is smarter than your physiology. Thank goodness we're in 2017. If you go to a doctor and your blood pressure is high, they are not going to look at the physical, chemical, or emotional stress load that causes an intelligent adaptation, which could be viewed as high blood pressure. No, he is going to look at this number and decide what is better for you. Except the side effect could cost your life. Do you understand? Okay, this is why it drives me crazy, because you're not going to see different animal species with high blood pressure. You know, you don't see the beaver coming in saying, dude, you know, I got a headache, my blood pressure's high. You don't see the antelope being chased by the lion, all of a sudden stopping, saying, you know, I'm really in a stressed state. My blood pressure is high. I think I'm going to just rest after this run. No, high blood pressure doesn't cause headaches, but would pain cause elevations in blood pressure? Yeah, this is huge. Understand this autonomic nervous system is affected by the curve in the neck. If you've got this fight or flight response, this sympathetic response, you're being chased by a tiger, you got elevations in heart rate, elevations in blood pressure, elevations in cholesterol, a thickness of blood, all of which is an intelligent response to keep you alive. In the parasympathetic state, this increases digestion. It helps your body regenerate tissue. The parasympathetic state is amazing, but we need a balance of these two. Knowing that both of them are affected if you have a loss of curve in the neck, it's important. 2008, sympathetic and parasympathetic response to diversified adjustments to chiropractic vertebral subluxations of the cervical and thoracic spine. No kidding. So it turns out that since this nervous system is housed inside of this flexible bony structure, that if there's any alterations in structure, okay, auto accident, working at a desk for 20 years, if that can cause an alteration, you're going to cause an alteration in that autonomic nervous system. You're going to cause an intelligent adaptation that in psychotic world, they're going to view it as pathology, when really it is intelligent. Keep saying to yourself over and over and over again, my body is adapting intelligently. Your body's responses are intelligent. Absolutely it is. When we look at this, now this is kind of hard to see, but right up here on C1, the top bone in the neck, okay? Look on the right side. This is a normal cervical curve. The top bone in the neck is a circle. You can see it right below that solid, round, beautiful moon-like bony structure. If you look at a circle sideways, you're only going to see 1/2, right? Now, if you can look really close at the structure on the left, you're going to see that top bone spun ridiculously far. This is a very obvious finding of the top bone in the neck that's massively subluxated, massive pressure on C1. We just read a couple of articles that says just adjusting this atlas vertebrae can alter autonomic function. It can change blood pressure. Well, this right here, this gal had it out for over 30 years. She had that pressure on her for 30 years. Now, 90% of the nerves that come off the spine, there's no pain fibers. But do you think that 30 years of pressure on that upper cervical spine could lead to stress? So what was she diagnosed with? Depression, anxiety. How do you think her sleep patterns were? Terrible, because she's in a sympathetic dominant state. Okay, elevations in blood pressure, everything else. I mean, so when you look at this, look at the body has an intelligent response. That would be like amazing. This brain controls and coordinates every function of the body. The central nervous system does. Okay, let's look at breathing. Is breathing important when you talk about the cervical spine? I mean, I'm going to tell you, C3, C4, C5 keeps you alive, nothing mnemonic. Okay, what does that mean? The phrenic nerve, the nerve to the diaphragm, comes out of the base of the neck. Now, when we breathe, that diaphragm comes down, draws air in. When we breathe out, it comes up, blows air out. Now, if you've ever heard of a hiatal hernia, that's a weakening of the muscle of the diaphragm. Why would people have a hiatal hernia and no one looking at the neck, no one looking at the nerves that supply the integrity of that diaphragm? Isn't that amazing? We do an entire talk on an hour of that. Also, look at the neck. We've got the sensor that's amazing in the neck. I know it's kind of gross to look at a cadaver sample, but understand, you got the heart located here. It spits off a main artery that goes up called the carotid. It goes into internal and external, and right at that bifurcation where it's bringing that blood up to the brain and the face, there's two sensors. One senses carbon dioxide, the other one senses blood pressure. And so if the carbon dioxide levels go up, guess what? Heart rate and breathing go up, so it can bring the carbon dioxide levels down. Carbon dioxide levels get down, the heart rate and breathing slows down. So depending on the level of that carbon dioxide, it's going to change the function of the heart. So if someone's diagnosed with cardiac arrhythmias, elevations in blood pressure, are those pathologies or are those intelligent adaptations? Intelligent adaptations. And in fact, when people are right now, they're throwing bricks at the computer saying, no, high blood pressure causes stroke. Well, let's look at the best therapy if you've had a stroke. Do you know that they elevate your blood pressure? Isn't that interesting? Okay, effect of increasing blood pressure on clinical outcomes of acute ischemic stroke. Think of this, and let's just look at it from a different perspective, one of logic and intelligence, not one of psychotic fear, which is what the medical system is teaching you, that your body is intelligent. You have a stroke, that means lack of blood supply, lack of oxygen to that tissue. And so what they found out, induced hypertension, they're causing high blood pressure, is standard therapy for cerebral ischemia in patients with vasospasms and a subarachnoid hemorrhage, after a subarachnoid hemorrhage, to increase cerebral perfusion pressure and enhance flow in ischemic zones, leading to improved neurologic function. In English, you got an area of brain that doesn't have enough blood flow or nutrients. We artificially elevate the pressure to get the nutrients, oxygen, to the area. Thereby we decrease the death of the neurons. You can actually save the brain. Amazing. They raise the systolic blood pressure in patients with acute stroke by 20%, not to exceed 200 millimeters of mercury. And of the 13 patients treated, 7 improved by 2 points on the National Institute of Health stroke scale. No systemic or neurologic complications were seen. And you might say, when patients come in and they go, man, I just came from the doctor, my blood pressure was like 180 over 100, and it's bad. And you know what I say? No, it's not. This is your body adapting. When was the last time you had a glass of water? Yesterday. You know? Okay, how'd you sleep last night? Horrible. You know, can you understand? There is nothing broken if your body can't regulate its blood pressure. It's functioning correctly. Let's look at arthritis of the cervical spine. I know there's a whirlwind tour of the neck, but I just thought, what the heck? Okay, we're looking at normal, okay? Grade 1 means the neck has lost its normal position of motion, but there's no destruction of the disc or bone. Grade 2 means there's loss of normal position of motion, and there's beginning destruction of the disc and bone. Grade 3, there's loss of normal position of motion and more advanced destruction of the bone. Here's the challenge. This is called degenerative disc disease or osteoarthritis. Arthritis, arth means joint, itis means inflammation. Osteoarthritis is a non-inflammatory arthritity. So let's see this in crazy world, okay? We found a change in shape of the bone and we called it joint inflammation. Then later on we found out that it wasn't really inflammation at all, but we didn't want to rename it. So we called it a non-inflammatory inflammatory condition. Here, man, it'll make sense. Don't worry, we'll give you drugs for it. Seriously, okay? Well, now here's what's really going to happen, okay? Is the body smart or stupid? Smart. So if you look at the phase 3 degeneration over there, you'll see perfect joints above and below. So many people come in here and they say, yeah, man, my doctor says it's old age, 55. No, seriously, okay? Okay, and I'll look at their grade 3 arthritis and I'll say, well, you got 2 perfect joints above. I'm guessing they're the same age. So I don't think it's old age. So what really happens is this isn't degeneration. This is an intelligent adaptation. See, arthritis only happens in trauma. So think of this. You need correct movement. You need correct movement and position to get nutrients to the disc. Bam, we got a whiplash trauma. Okay, that whiplash trauma throws the head forward, instantly spasms out the muscles. You go to stupid care. Okay, you get the muscle relaxant, the Flexeril, which is a central nervous system toxin, but by God, it relaxes those muscles and you feel better. Okay, you get some numbness and tingling down the hands because the head is way far forward. Don't worry, you get the gabapentin for that neurogenic pain. And it helps a little bit, okay? But then your blood pressure goes up because your head's so far forward. And you can you see that? Okay, so let's just look at how the body responds. You get a trauma that increases the muscles. You increase the spasm, you decrease the motion. So you've got a bone up here and a bone here and a disc space in between. If that disc can't get its nutrients, then the disc gets smaller, so you get less stability. So what the body's going to do, it's going to increase the surface area where those 2 bones connect. So this is not pathology, this is an adaptive physiological response based on long-term trauma. Now, we can reverse this from grade 3 to normal, okay, by causing inflammation, because what are you going to do? You're going to induce motion, induce inflammation. That's going to start to regenerate the disc. If you regenerate the disc, that increases the space, and you start to see the bone spurs go away. Okay, this is Wolff's Law. Bones lay down where it's needed, resorb where it's not. And we can show before and after x-rays of disc spaces regenerated. This is vital because if you lose the curve in the neck, by God, you're talking about pressure on the brainstem. You're talking about pressure on the spinal cord. This is vital. So when we look at this, we know what a normal disc is. We know what degenerated. What is degenerated? It's from trauma. It's not from old age. That's psychotic and stupid. We'll flush that one down the toilet right now. Okay, this is absolutely from trauma. And it's an adaptive physiologic response, not a pathologic. This is hugely important that you understand this, because if you have had a trauma, and I'm talking falling off the swings when you were 7, I'm talking the football injury when you were 18, 19, you know, the bad relationship that you kicked him out of the car when you were 22. Wait, no. All of these different traumas are going to lead to an alterations in that. Now, the disc is really tough. You're talking 80 interconnecting rings of ligamentous tissue. That's a disc. Discs don't herniate quickly unless it's a massive pathology. I mean, that's ridiculously rare. What happens is you got an alteration in movement that triggers the muscle spasms, decreases the nutrients, and the joint deteriorates. Or does it really deteriorate, or does it change its shape in order to stabilize? God, that makes more sense. But we're not going to rename it because we're so ridiculous in our infrastructure that we still call osteoarthritis arthritis, not inflammatory. Let me say that in English. Osteo, non-inflammatory, inflammation. Yeah, I can't even say it because it's stupid, okay? Let's look at what Kirkcaldy and Willis is. Now, this is the biomechanic Bible. This thing is brilliant. What they did, they took samples of cadavers that were young, samples of bones and discs of cadavers that were old. They put them through compression force loadings, traction, torsional, all of these things. And they found out, oh my gosh, many elderly joints proved to be just as strong in torsion or compression as the younger ones. That's right. How many old bulls in the room? Yeah, baby. You ain't taking my tribe. Okay, so when you look at this, it's not age. It's lack of motion that causes it. So all that stuff that people talk about, I mean, this gal, I think she was 93 when this picture was taken. We're going to be strong and flexible and healthy. The psychosis that we have today are those people in the wheelchairs. It doesn't have to be that way. Why? Because, and we're not going to go over all the different diseases that they use to treat, okay, arthritis or problems with the joints. Let's just look at a couple of popular ones, okay, like Tylenol and non-steroidal anti-inflammatories. Both of these inhibit the building block of cartilage. Okay, granted, Tylenol is the deadliest drug in America, but both inhibit the building block of cartilage. So of course, the American Journal of Medicine. So you do have joint pain? Here, take acetaminophen, Tylenol. It will destroy your cartilage, but you'll be comfortable while it's being destroyed. Honest to God, why do they pass this stuff out? Either the doctors, we've got two choices here. Either the doctors are completely ignorant of the effects of this drug on human beings, okay, or they know the effects of the drugs, but it's their protocol. So ignorance is our best hope. You're right, my sarcasm is showing. Okay, I'm sorry. Okay, Tylenol, 1 in 3 Americans take it. 56,000 people go to the emergency room for it. Leading cause of liver failure. Other effects of Tylenol: dulled emotional response, increased asthma risk, toxic epidermal necrosis, and increased blood cancer. Journal of Hepatology. Its benefits are said by the Food and Drug Administration to outweigh its risk. It must still be asked, is this amount of injury and death really acceptable for an over-the-counter pain reliever that destroys your joints? Know if you have this, and this is what I tell my patients. Okay, I know you got numbness and tingling in the hand, but does your other hand work? They'll go, yeah. Okay, great. When you get home, go to the bathroom cabinet. You might know it has a medicine chest. Open it up, grab the Tylenol, and put it in the trash can. And if you see Motrin, Aleve, or Advil, you do the same. Okay, granted, it may toxify the landfill, but that's the next generation, and we're really concerned just about this one. Okay, so, glad somebody gets my sarcasm. Okay, so we look at normal, we look at not pathology, we look at it as a stabilization aspect of this. And then what do you do, okay? How do you know if the neck can be corrected? We're looking at neutral, which is on the left, and extension. Granted, they're not looking up very much, but at least it is mobile. And this is what we do. When we take a neck x-ray, we'll take an extension x-ray to see if the joints actually move. Why? Because we want to be able to predict that we can help them. What we're looking at, here's a reverse curve and here's a normal curve. And this is a shout out to our patient in Hawaii who came out. She knows who she is. She's really cool. Okay, but this is her before and after. But when you look at it, you're looking at a massive pathological and a restored one. Now, that was over a couple of weeks. Now, here's a gal that came down from San Francisco. Again, a loss of curve, reverse curve, down to near normal. Okay, and so why? How do you get this corrected? And a lot of people, we just had a patient today who's a relative, came in and said, oh, that cracking. And I just took her x-rays. We're talking reverse curve, beginning degeneration. We're talking major pressure, and I'm looking at her x-rays and I'm going, my God, you don't have heart palpitations yet? because the nerves that supply the heart, they're compromised. She said, oh, I don't want to get my neck cracked. And I said, okay, cool, man, wait till it gets really bad. You know, and if you're transportable, if you're ambulatory, you can come in and then we'll try and fix you if we catch it before the joints fuse. So what are they afraid of? Strokes and chiropractic. Well, let's look at the facts. I do an entire hour on this. Let's look at Frank Silver, researcher, professor of medicine at the University of Toronto, director of University Health Network Stroke Program. And they said, we didn't see any increased association between chiropractic care and usual family care and stroke. Well, let's look at the facts. Spinal manipulative therapy. It happens, an incident of trauma happens every 1 in 5.8 million. Wow, cases. Yeah, I know. That's one occurrence in every 48 careers. Let's equate that with stuff that you might be familiar with. Death resulting from non-steroidal anti-inflammatory use is 1,500 times greater than risk of injury from a cervical manipulation. Getting struck by lightning is 1 in 600,000. So this means you have a 10-fold greater risk of getting struck by lightning than injured by a chiropractor. No, don't go outside. Yes, there are clouds. So let's look at how the body actually works. So it turns out that mobilizing, getting the joints healthy is better for you. The risk of stroke in the general population is about 2 for every 100,000 people, and injury in spinal manipulative therapy is about 1 for every 5.8 million. That means the risk of stroke with chiropractic care is 0.000000, that's 6 zeros, 17. Now, if you don't get your neck corrected, it's 0.0002. So you have about 1,000 times greater risk of getting damage if you don't get your neck adjusted. It turns out that, I know this is a big shocker, restoring normal form and function, restoring the nerve supply to the heart, helps your body regulate itself, can actually reverse degeneration, can correct arthritis, and restore nerve supply to the lungs, diaphragm, shoulder, and nerves. Turns out it's actually good for you. Well, let's look at that other fun stuff. Lumbar spinal surgery, the risk of death, okay, is 7 for every 10,000. 2-month course of non-steroidal anti-inflammatories. Remember, that's the drug that destroys joint cartilage and makes you comfortable while it's being destroyed. 1 in every 1,200. Death rate for acetaminophen is 1 in every 2 million tablets sold. This is what drives me crazy. Here's a patient that actually came in. We're looking at the center picture is the side view of the low back, and we're looking at an artery that shouldn't even be seen. So that's massive atherosclerotic plaquing. Yes, statin drugs do increase atherosclerotic plaquing. He's got a reverse curve in his neck, and he's got massive subluxations at the sympathetic nerve supply to the heart. His wife forced him to come in. His whole report was done like this, okay? And I said, well, this is exactly what you got. You got a reverse curve, you got this, you got this. I'm not going to let you touch me until I talk to my cardiologist. Okay, great. I'm sure your cardiologist is an absolute expert in reversing degenerative arthritis and an expert in the nervous system, so he's going to tell you that you don't actually have a heart problem, you have a nervous system problem. I told him that. Yeah, that'll work. Okay, so let's show exercises that you can do. Yes, I did invent this. Yes, it is ridiculously simple, okay? It's a band of tissue, nylon, and pipe insulation. Okay, you can do the same exercise with a towel. What you do in this, ask your chiropractor if this is appropriate for you because you need to get your neck checked. It goes around the base of the neck. You don't pull out, you pull down, you point your chin to the ceiling, you look straight ahead and relax it. You're putting about 2 pounds of pressure down, and this is going to hydrate the discs because remember, movement gets nutrients to the disc, and it's going to start to restore the cervical curve. It will only work best in conjunction with corrective chiropractic care, but you can actually work. It'll restore it. This is fantastic. Use it as a towel, but you got to make sure that your neck is able to look up. People are so pathologic today that their neck is so damaged that, I mean, you can't recommend this for the average person. So make sure that you get it checked by a corrective chiropractor, not by the local cardiologist who doesn't know his butt from a hole in the ground. Okay, so this is another one. Remember when you were 12 and you watched TV like this? Okay, I got these pictures off of the YouTube on how to correct your cervical spine by Dr. Bergman. I don't have these, okay? I did a screenshot, okay? So this is the best I could do. Okay, when you were 12, you were watching TV like this. Imagine if you had a desk here, okay? And your neck is tight and stiff because you've been typing all day. Put your elbows on the desk, lift your chin up, and deep breathe for 10 minutes. So what that's going to do, deep breathing increases intrathecal pressure, forces fluid in the disc. The discs are 70% fluid. You're going to get the curve back in the neck. I mean, brilliant. This is how you actually adjust for chiropractors out there who aren't familiar with adjusting. And this is also to demystify the actual act of this. You're looking at a patient here whose head is not turned like this. The head during the adjustment is turned no more than 10 to 15 degrees. It's in slight extension. And we go along the plane lines of the disc using about 2 to 4 pounds of pressure. This is the adjustment position. Does that look traumatic? Well, I know to you, but you saw way too many Chuck Norris movies. Okay, I'm talking to the average person that wasn't addicted to Chinese theater when we were kids. Okay, it's very simple. It's very safe. Why? 1 in 5.8 million. It's 1,000 times, it's 10 times safer or more dangerous to walk outside and possibly be struck by lightning than injured by this. Do you understand? Okay, and I put this up because I'm really pissed off that my relative didn't get that, and she's gonna die badly and early if she doesn't get the big picture. Do you know why? Because I failed explaining this to her. I know. So let's look at normal anti-inflammatories. A chemical anti-inflammatory like Tylenol, Advil, Motrin, and Aleve, they stop the healing process, which inflammation is. Inflammation's a healing process. The way these guys decrease inflammation creates free radicals. It's actually a process where you break old tissue and build new tissue. And if you're creating that inflammatory response, you create free radicals too. The cool thing about this is that all of these things, they're antioxidants, and they take care of those free radicals, so it makes inflammation more productive, where you can actually regenerate healthy tissue. Yeah, broccoli, sweet potatoes, juice. What other things will work? Fish oil. I mean, there's tons of stuff. I mean, all natural, normal, healthy foods are there. This is what you gotta do to have a normal, healthy body. Normalize your gut flora. Water, is that important? Absolutely. How many people drink enough? Not many, but it's got to be clean. If you're going to have a reverse osmosis, we have a reverse osmosis filter. Then we have a system that remineralizes the water and ionizes the water and alkalinizes the water. This stuff is gold, baby. Bring your water bottles. The guy, when we put it in, he said, you know, you could open a water store. And I thought, no, I want to hydrate my patients. This is what you need. Okay, when we talk about health of the cervical spine, can you understand that it's not the cervical spine? It's the nervous system. Can you understand that regular exercise, and I'm talking simple stuff, very, very simple stuff, can regenerate the tissue, but it actually alters how the brain responds to the environment. You got to do it. Proper nutrition. This is how your body regenerates. Sufficient sleep and prayer and meditation. Now, all of this stuff, go to our database. Now, and we've got everything on there. Now, any questions about this? Because I know I covered a lot, but realize that we've got an hour on arthritis, an hour on hiatal hernias, an hour on the heart palpitations. We've expanded this. I'm just jumbling everything in one talk. Yes, ma'am.
I had a reverse curve, as you know.
Yes.
So because
Wait, you had a reverse curve, as we know. Do you still have a reverse curve?
No.
No.
Okay, my question is, sometimes I'll walk past a mirror and my head still is forward. Does that mean the muscles are just used to going that way?
No, it typically means that you're, okay, she asked, she used to have a reverse curve, now she's got a curve back. She walks by a mirror, she sees that the head is slightly forward. Now, the head is going to go forward if there's dehydration here to open up those discs. So if there's lack of movement, lack of exercise, or lack of keeping that neck curve there, in between the shoulder blades is going to be tight. So think of this for everyone. If your shoulders are consistently tight, there's a problem. It means that the head is forward or there's lack of motion here. So if I was really mean, I would say, are you using the foam piece to restore the lumbar curve? Because if your lumbar curve is healthy, it's going to reposition the shoulders. If you're doing all the exercises to keep the thoracic mobile, or if you've recently had a trauma where you, I don't know, broke an arm or something, that could have limited your motion for a little bit, altering your mechanics. Not mentioning any names. Yeah, but it'll come back. Just keep doing the neck curve exercise. Yes, ma'am.
What kind of mattress or pillow would you recommend?
Oh, what kind of mattress or pillow would we recommend? If you have a neck curve that's lost, forward, or bent, I have no idea. Okay, it's anybody's guess. Okay, find the most comfortable position. One of the best pillows out there is a buckwheat pillow, because what you want a pillow about this distance when you're on your side and about this distance when you're on your back, roughly. Okay, if you're sleeping with your head massively forward, you're actually creating pathology. So when you have a beautiful 45-degree cervical curve, when you're perfectly straight, you'll find sleeping on your back and side comfortable. If you're a heavier framed, solid person, you're going to want a firmer mattress. If you're a smaller framed, lighter person, you're going to want a softer mattress. My goal is to make everyone normal. Here's the problem. When you were 12, did you have to say, hey, you know, I do a sleepover, but I'm just not sure. What's your mattress like? No, you didn't care. You were going to sleep on the couch, the floor. It didn't matter, right? Okay, so in psychotic world, we're believing that we have all these pathologies, so we have to have the right pillow. We have to have the right thing. No, my goal is to turn everyone into 12, like I am mentally. You know, because that way we don't need it. But, you know, I mean, until we get the body healthy, you know, a pillow top was good because it'll add some support. You know, medium or firm frame or soft, depending on your body frame, and a buckwheat pillow is ideal. Yeah, my wife's nuts. She's got a 20-pound buckwheat pillow that has its own suitcase. I know. Any other questions? Because next week we're talking about pelvic health, and that is exciting. Thank you very much.